everyone. Thank you for joining us today for our webinar about improving patient safety and registration accuracy through biometric patient identification. My name is Amy Leopold, and I'm the Product Marketing Manager here at Forward Advantage, and I'm the moderator for today's webinar. Today we will be discussing the importance of an effective solution for positively identifying patients. Many healthcare organizations are challenged with older manual processes that can lead to patient safety issues such as misidentification and duplicate records. We hope our webinar today is a good resource for how to improve patient safety with an accurate patient identification solution. Just a couple of housekeeping items before we get to the meat of our presentation. There are quite a few people on the line, so everyone's phone is muted. If you have a question during the webinar, please enter it in on the question panel, and we'll do our best to answer the questions at the end of the webinar. We are recording this webinar, and we'll send it out in an email after the webinar is over. And again, thank you everybody for joining us today. I'd like to go ahead and introduce our speakers. Today we have Oscar Beninati, Director of Sales here at Forward Advantage, as well as Justina Evloyavis, Senior Product Marketing Manager of Patient Secure at Imprivata. Both of our presenters have great experience in healthcare, and we're very happy to have their expertise with us today. So with that, I'll pass it over to Oscar and Justina.
Thank you, Amy. I appreciate it. So welcome, everybody. We appreciate your time. Today we'll be going over several solutions, and this is the agenda for today. Excuse me. We'll be talking about what Imprivata Patient Secure is and what biometric identification is all about. We'll also be talking about the risks involved with identifying a patient. What are the cause problems that we're going to be able to solve for you? How the technology works and how the solution can help you overall. How does your staff use Patient Secure on a daily basis? And then we'll have time for questions and answers from our audience. So with that, let's get right to the Patient Secure solution. So Justina, welcome, and thank you very much for attending today.
Thank you for having me.
So tell us a little bit about what palm vein scanning is all about.
Sure. So palm vein biometrics is the method of positively identifying a patient through their unique vein pattern. There are a number of different identification solutions to identify patients. However, palm vein authentication is the most unique but also the most adopted solution on the market today. Specifically, the way that it works is everyone has a unique palm vein from birth to death. Even twins have different patterns. And it's actually the vein within your palm and the template of that, not a palm print. So it's very different than something like a fingerprint, which is something that you could potentially leave behind at the crime scene or might have suicide connotations. And it's something that's non-invasive, unlike something like an iris scan, which is a pretty invasive way of identifying patients.
Excellent. So how does palm vein scanning work in a hospital setting for us?
No, absolutely great. So the way that palm vein scanning works within a hospital setting is through a solution called Imprivata Patient Secure. And Imprivata Patient Secure is the positive patient identification solution for healthcare that uniquely identifies patients with their palm scan and then automatically brings up the correct medical record for that patient or the registrar or clinician. So as you can see here on the screen, a patient would walk into your healthcare setting, whether that be your hospital or your clinic, and they would present their palm down on a reader one time. Scan takes about 2 seconds. It will uniquely identify them and then automatically bring up their correct medical record.
That's great information.
And from an Imprivata Patient Secure perspective, the solution has been on the market for over 10 years. We have over 70 health systems with 400 plus hospitals that have deployed this, so it is the most widely deployed solution. And we're managing up to almost more than 9 million patient identities at this point today.
So Justina, what are the risks in trying to identify a patient at the time of presentation at the hospital?
Yeah, great question. So when it comes to patient identification, there's so much at risk. Healthcare has spent so much time and money, billions and billions of dollars, implementing these amazing EHR systems and going digital, but yet the core component of that patient's record is their identity. And if you don't get that right, then you're just putting, bad gasoline in your brand new Maserati, if you will. So there's 4 key areas around patient identification that are a huge risk to patients and hospitals. The first one is medical errors. Johns Hopkins just came out with a report that found that medical errors are the 3rd highest cause of death in the United States, and 30% of medical errors, such as medication errors, blood transfusion errors, and radiation overdose errors, are directly tied to patient misidentification. In addition to that, 5% of wristbands that are placed on patients are placed on the wrong patient. So once you get that medical record wrong and that identity wrong, you could really lead to an adverse event or even a death for a patient. The next area is identity fraud. Identity theft and fraud is growing at over 22% a year. Over 22 million Americans were impacted by it in 2014, and it's significantly on the rise. That can be whether someone steals your identity or actually you've got maybe 2 or 3 brothers sharing one insurance card. This not only is a risk to patient safety because now you're commingling patient information, but it's a huge issue for the hospital and the hospital's revenue cycle, which leads us to our really last 2 areas, all around revenue loss. If you misidentify a patient, you're going to end up having revenue loss for the organization. That'll come from a number of different areas. It'll come from denied claims because maybe you had an identity theft case, or maybe you didn't have the correct identity and that person didn't have the right insurance, and now the hospital is responsible for eating the cost. Or it's maybe something like identity theft happened and you hurt a patient and now you've lost their retention and loyalty. So those are kind of 4 key areas that are an issue. And when it comes to inaccurate patient identification, there are 3 core causes of what ends up resulting in a misidentified patient. The first one is duplicate medical records. I can't tell you how big of a problem this is. On average, the average duplicate medical record rate for a hospital is over 10%. So 10% of the time when you search for a patient, you're going to get the wrong medical record. That's pretty scary in my opinion. We've seen organizations be able to significantly reduce that with Palm Vein Biometrics. The next issue is medical record overlays, and that's really where, let's say you have an identity theft case or an insurance card sharing case, and 2 or 3 people are sharing one identity, and now you're commingling all of their information. So for example, you might have the wrong allergies, which could lead to a medical error. The other issue is these are very, very expensive for hospitals to clean up. Cleaning up an overlay and unmerging it can cost your HIM department up to $5,000 per record. So it's a very, very costly problem to have in addition to a patient safety problem. And why is it so difficult? Well, name and date of birth, as the population has grown, is no longer unique enough to identify patients. This is an example of an organization called Harris Health System, which out of their whole patient population, they had 231 Maria Garcias with the same name and same date of birth. So if I'm a registrar, often when our customers are talking to their registrars and training them, they tell them when you pull up a record and you don't know, create a Jane Doe. That's typically what we're hearing. And so when you show up with 231 Maria Garcias with the same date of birth, you're not going to take the risk that you're going to pick the wrong one. You're just going to create a 232. And so then the HIM department has to do all that cleanup, which ends up impacting the revenue cycle, and it's a huge, huge problem.
So Justina, those statistics are amazing and are very critical to our day-to-day functionality of a hospital. So can you explain a little bit about how Patient Secure integrates with an EMR system?
Yeah, absolutely. So Imprivata Patient Secure is integrated with both your EHR system, but mainly the registration system on the front end. So the way that we work is we fit into your existing workflow. Let's say you've got your Meditech system, for example, that the registrar does a patient search in. Imprivata Patient Secure will be directly embedded in that. So it's not a separate application that they have to search and access. It'll be part of that workflow. The registrar will search for the patient using their palm. It'll bring up that record, and now they'll have that patient record right in front of them. Similarly, in the clinical setting, if you're doing something like bedside registration, which is done by clinicians, this is something a clinician could do as well. And this could even work in a mobile workflow where you've got your workstation on wheels and you want to identify a patient in another setting. You would just do that, and it would bring up the record right there. Another area that it integrates with the EHR and registration system is across your health system. So today, healthcare is consolidating. Our customers have, 10, 15 hospitals, 200 clinics, and they're growing. And much of the time, they have disparate EHR systems or EMPI systems, which is your Master Patient Index. Inprobata Patient Secure has the ability to be that single biometric link across all of your disparate identification systems. So that whether I'm a patient that goes to Hospital 1, Hospital 2, but then I go to a clinic and that has a different EHR than Hospital 1 and 2 did, I can still be positively identified. So we really are covering you across your entire continuum of care.
So that's great information. So we talked about how it works with the EMR system. We talked that it works about with clinics. We talked that it also works with a physician practice. How does it work? How does Patient Secure work in the ED?
Yeah, the ED is a really, really great use case for Patient Secure, and it's one of the reasons why palm vein scanning is the only type of biometric platform that can be used in the ED. So if you've got palm vein scanning in the ED, let's say you identify a patient that's in an emergency situation. They're being brought in by the ambulance. You have no idea who they are. They don't have ID. You can't recognize them. Now, if they show up in the ED and they're unconscious, their eyes are closed, but they're still alive, as long as the patient is still alive and blood is flowing through their veins, you can place their hand on the scanner and it will automatically identify them. Patient Secure has been able to identify thousands of Jane Does and John Does across the U.S., and that is really something that can be life-saving when you've got a clinician that can now know the state of the person that they're treating, what their medical history is, what their allergies are, etc. And this is something you wouldn't be able to do with something like, iris scanning, for example, because you couldn't actually get the patient, their eyes would be dilated or their eyes would be closed. And that's why palm vein is great in this type of workflow.
So this is a large safety aspect as well, correct?
Absolutely.
Excellent. So what are some other use cases for Patient Secure?
Sure. So when we started looking at patient identification, we started at the registration system. So what we have found is that the point of care is really a growing, blossoming area for positive patient identification. A great example of that is radiation oncology. As I mentioned earlier, when I was talking about all of the patient safety statistics, 30% of medical errors on radiation overdoses and medication errors and blood transfusion errors are directly caused by patient misidentification. So in the scenario of radiation oncology, where very often at the point of care, people are using a license or a photo ID to identify a patient, well, if you've seen patients that have gone through radiation treatment, they look nothing like their license when they're halfway through their treatment and towards the end. And therefore, using a photo ID can be very dangerous because you're really not sure that person is actually the right person in front of you. And with radiation oncology, you're able to integrate Inprobata Patient Secure directly in front of the linear accelerator so that when the patient comes in, they place their palm down right before they go into the accelerator, and it'll actually bring up the correct record for the radiation treatment. So you're bringing up the right record and you're not accidentally radiating someone for breast cancer instead of colon cancer. So this is a huge, huge safety benefit as well as a patient satisfaction benefit as well.
Excellent. Thank you. So thanks, Justina. We really appreciate all of that information. What are the overall benefits for Patient Secure for a hospital setting?
Yep. So we've seen customers be able to deliver a number of benefits to their organization. The first one is all around patient safety. So we've seen customers eliminate duplicate medical records from 10% to 0.01%. And that 0.01% might be, your remote population or a baby being born right away. And we're also able to identify those unconscious patients and bring up that medical history. So by being able to integrate with your system, your EHR system, and giving that clinician the immediate access to the medical record and the right identity, you're automatically preventing medical errors and potential adverse events. The next area is prevention of identity theft and medical fraud. 100%, you can, once you've identified the right patient and enrolled them, no one can ever use their identity again. That benefits both patient satisfaction, but it also is going to benefit the organization from a revenue loss perspective because they're not going to get denied claims and bad debt because of an identity theft case. And the last one is an improvement in revenue cycle efficiency. We've seen organizations significantly reduce the cost that they were spending for duplicate medical record cleanup They've been able to take those resources that were doing that before and migrate them over to do other things for the hospital. We've been able to deny those medical claims and reduce the amount of bad debt, and also, really improve patient retention. If I'm a patient and I know that I can go to a hospital without having to give out my social security number, and I'm an elderly patient, for example, that lives in an area where identity theft is on the rise, I'm going to go to your hospital first because you've got patient secure, instead of going to a whole other hospital that I know doesn't know me. And so patient loyalty, satisfaction, and retention is really the last great benefit as well.
Excellent. That's fantastic information. Thank you so much, Justina. I really appreciate your time and your expertise on showing how Patient Secure can help a hospital save money, but also improve patient safety. So at this time, we're going to take some questions from our attending audience. So I'm going to hand this back over to Amy. Amy, it's all yours.
Great. Thank you so much, Oscar and Justina. That was a great quick look at Patient Secure. And it looks like maybe we do have a question coming in. Oscar, it looks like maybe this. Oh, go ahead, Justina.
Oh, I was just going to say I'm happy to read it out for you if you'd like. So this question is asking about, how does the solution work, from a technology perspective. So this solution today is an on-premise solution, and it's very great because you could actually have it on-premise and work across multiple organizations, as we mentioned, from that perspective.
Great, perfect. And then it looks like also this one might be for Oscar. Oscar, this person is asking what is Forward. Oh, okay, I get what they're asking. What is the relationship between Forward Advantage and Imprivata?
So yeah, that's a great question. So Forward Advantage and Imprivata have partnered since 2006, where we handle all of their solutions. We not only sell their solutions, but we actually implement and service all of Imprivata's solutions, from identity and access management to core text messaging, as well as the Patient Secure solution. Again, this is a relationship that we've had going for over 10 years now, and we look forward to doing this in the future with Imprivata.
And as do we. Amy, I think I saw one more question come in that I just wanted to take as more coming in. And that question is, how does staff get adoption with patient adoption, like with this solution? And the answer to that is this is really a solution where the entire organization needs to buy in, but it's something that the registrars in the organization will see great benefit from an efficiency perspective and being able to recognize patients. And as part of the solution that we provide with Forward Advantage, we also provide a number of services that allow your organization to really market the solution to your patient population. We've had hospitals be on, the local news networks because patients went and talked about how great it was what they were doing. We have a number of, tools for both registrars and training and tutorials for patients and clinicians, and a really robust methodology for deploying the solution and getting it adopted within your organization.
Great.
Justina, another question another question that just came up that I always get when I'm on a sales call is, are your right hand and left hand different when it comes to palm veining? And also, are identical twins different?
That's a great question. So generally we always, so number one, identical twins absolutely are different. And yes, your palms are different. So what we do is always recommend you use people use the right palm. But if you have a scenario where you have a patient that maybe is an amputee and they only have one arm, then they would just use that arm specifically.
Okay. And at what age do you recommend we start scanning patients' palms?
That's a great question. So again, as I mentioned, your palm vein is developed at birth and in the womb actually, and it goes through your entire life. So from a technology perspective, you could start scanning immediately. However, what we recommend ages 3 and up, mostly because you really need to get that child's hand on the right placement to enroll them. And in the benefit of the solution as well is that in a scenario where you have pediatrics, like a children's hospital, for example, and you start using it ages 3 and up, every year the system will prompt you when that person comes back, let's say for their annual checkup, to re-enroll, because your hand will grow, the palm vein will stay the same, but your hand might grow or expand a bit. And therefore, we always want to have the latest size of that palm pattern.
Fantastic. The only other question I have that I get when I'm on the road is, when you register patients, is this done as they come in? Do we do vendor fairs? How do we handle it?
Sure. There's a number of ways that organizations handle it, but we recommend, really starting with things like enrollment fairs, where you go to, let's say you have a blood drive that's coming up, or flu season is a fabulous time to do this when you're getting everyone's flu clinics and flu shots. Wherever you've got patients in a high population that are centralized, it's a great time to be able to do an enrollment fair. However, at the same time, you should always have, this right at your registration stand. And when the patient, comes in, the registrar says, place your hand on the scanner. If they're not recognized, they know they're not in the system, and they'll go ahead and enroll them. So it should be directly part of your registration workflow. And then in order to get people into the system faster, you can do things like enrollment fairs, which Improvada and Florida Advantage help with.
Excellent. That's great. Amy, any other questions from the audience?
No, that looks like it for today. We had some great ones, and thank you, Oscar and Justina, for giving us all this great information about Patient Secure. We are going to go ahead and close the webinar, though, but I do want to show the slide, Oscar, with all our contact information to make sure the audience can take a look at that before we sign off. So if anyone does have any questions or would like more information about Patient Secure or more information about how palm vein technology works, please email us. Here's our information at our email address. You can always call us as well. We'd be more than happy to talk with anybody about your specific use cases or how the solution can help any of your healthcare organizations. And with that, we'll go ahead and end the webinar. Thank you again, Oscar and Justina. We had some great information today, and thank you everybody on the line for your time. Hope everybody has a great rest of their day. Thank you so much.
Thank you.